Hello, good morning, everyone.
Morning.
Welcome to Evolution Health for the Wealth of the Nation. Thank you for joining us. It's 11:02 on my side here. Thank you very much. I hope you've enjoyed the music, AXA music that we've been playing, and we are here this morning to go straight into one of the things that we've had lined up for the 10th commemoration and celebration of the 10th year anniversary of AXA Mansard Health, who is 10 years of operations, and we're celebrating them, and we have a list of activities that have been planned for this period. And today, as part of those activities, is the virtual conference. While you do all the enjoyment and stuff, we also need to look at things more from the progressive perspective, because in Axaman side, we are always about progress. So what does the next 10 years, what does the future holds? And it's in forums like this that we can look at those things and begin to educate ourselves. So I want to welcome everyone. All the panelists are up and running, and thank you for joining on time, all the panelists. Without wasting much of the time, we go straight into the conference for today. And to set the tone for this conference is no other one than the Chief Client Officer of Axamansat PLC, in the person of Rashidat Adebisi, who is going to give us the opening remark to set the tone for the conference on Revolution Health for the Wealth of our Nation. Rashidat, welcome. Thank you very much.
Thank you, Shesa, and good morning to everyone on the call. I hope you can hear me clearly. I'm super excited to be here today. It's such a great feeling. You know, when you have a child, you celebrate your first birthday and 10th birthday, depend on the combination of your family agreement, you know. Some people celebrate the fifth birthday. So for us, this is such a momentous period that we just didn't want to celebrate amongst ourselves, but share with everyone. And welcome to our webinar. This is one of the series of activities we've lined up to celebrate, to make sure that we commemorate as well, working with everyone on this anniversary of our health company, AXA Mansard Health Limited. This conference is actually very significant for us, by the way, because, you know, we're all facing significant socio-economic challenges as Nigerians, and we need to reinforce and highlight, you know, wellness issues, because this is extremely important for our nation when we think about sustainable prosperity. This is so critical. And this is where the theme Wellvolution comes from. And the theme for today, for this webinar, is health for the wealth of our nation. And it doesn't just, you know, the theme is not just about speaking about how AXA Mansard wants to play alone. It's really just, you know, driving the sort of direction we're going for the next stage in our journey of our corporate existence. We want to draw the attention of everyone to the urgency, really urgent situation we have to drive universal health coverage for all Nigerians. And this can be done by AXA Mansard alone. I mean, depending on which number you're checking, we have all sorts of people giving numbers. Some people say there could be up to 6 trillion naira. That's a lot of money, you know, being paid out of pocket for healthcare in Nigeria. And insurance, you know, still doesn't contribute significantly to either the GDP or to the insurance density, which talks to how many individual people are actually insured in the country. So because of this, you know, it really got us to say, look, how do we drive the conversation? How do we help to lead the points on the need to invest and to create these conversations to say, look, every one of us, let's work together. How do we just bring to the fore that we must all work together on this path to universal health coverage, either whether for corporate organizations that we've seen significant progress on, or just around social responsibility for us, you know, as AXA. And we intend to keep the conversation going, not just as a corporate organization who is an insurer, but because we're also a responsible citizen of the country. and we want to help drive change. Right now, we have data like, maybe 55% of Nigerian adults who are less than 35 years old. That means from 18 to 35 age range, and who live even whether in, I think mostly in the rural area, of course, are not actually protected. That's such a big, wide, a gap. That's what we call it, from healthcare, the healthcare net. And these are people who are going to be the real drivers of the country, of the population, of the growth, whether as employees, whether as people who start SMEs, they will help drive productivity. So when we bring more of these people who are currently excluded, who are our citizens under healthcare insurance, it means that they can put away a known amount of money to protect themselves from an unknown risk, in the future. And this could significantly affect, the citizens, businesses, even our economy as a whole, because this is a time where we all have to pull together. And of course, as you know, resources are scarce, because even on everybody's side, no matter who you are. So for us in AXA Mansard, we actually went about to look for fantastic speakers, experts, and whether as a main speaker and also as our panelists. These people are all experienced people, and they also are very passionate people. They're passionate about our country, they're passionate about growth, and I'm really excited to have every one of them here today. I want them to come and just help us start this conversation to make sure that we can, get some of the insights, from the session that will help to jumpstart some really, really big conversations, and will create awareness for every one of us here. We have individuals, we have corporate organizations, we have providers, and hopefully even investors on the call today. We'll want to jumpstart this conversation about how do we really drive universal health coverage? How do we drive total wellness? AXA has always been one who talks about wellness, physical, mental wellness, because this is very, very important to us, and ensure that we can have a prosperous future for our country, Nigeria. So AXA Mansard is, really, really committed. Our purpose. I like to talk about it a lot. So sorry if you've heard it from me before. Our purpose is simply, to act for human progress by protecting what matters. And what matters keeps changing no matter what sort of, lifestyle stage you are in. And I actually expect this session to be very insightful. I'm sure there will be a lot of illuminating facts that will come out. And I can reassure you that the speakers today are top notch. So I'd like to take this opportunity to welcome all our speakers, the speaker, of course, the main speaker, our panelists. And I hope you can see them already, and just get them to please be open, engage, bring your very best to the table because we know you have it, and share with our listeners. I see we probably have almost 200 people on the call today. So you have the opportunity to impact all of these people. And so we look forward to that, to just get the conversation moving. The session, of course, will be, well compared by some of our top people. You have really, really interesting, both AXA and non-AXA employees. And I'll just, sort of leave the stage for my colleague, Sheson, to just take the conversation forward. So thank you, everyone. Great to see you all, and I look forward to a very engaging session that will move forward to the next stage of the journey of our country and prosperity for everyone. Thank you, Shesa. Thank you, everyone. We, you're muted, Shesa, just in case you're speaking on our side. Thank you.
I was speaking. Thank you very much, Rashida, for
Technology.
that insightful opening remarks, setting the
Sure.
tone about what we are expecting today. And Rashida has gone far into how we have deliberately selected eminent speakers who will dissect some of the required things that we need to do to use through quality healthcare, well-being, build the wealth of our nation. And we are going to be looking at that from four major perspectives: the employer, government and regulatory authorities, investor and technology, and also we are going to be looking at it from the provider perspective. And we have a lot of people already online. So just a few ground rules before we start. Professor Pat Utomi, who is a keynote speaker, is joining us very shortly. We had a little bit of glitch, but we are resolving that, now. So, okay, I can see him. Just give me a minute to promote Professor Pat Utomi to be a speaker. All right. I just did that. So Prof is on the call. So like I said, just a very quick ground rules about what we are doing here today. As you see, we are using the conference setting, which means that if you want to, we favor more questions and answers using the chat box. If you look just below your screen, you will see the Q&A point, so you can send questions from there, and all our panelists will be able to respond to them. So wherever you belong in the 4 dimensions that I've spoken to, there is somebody here who has wealth of experience about how we can take things forward from there. Also, if we have time, we'll be able to take voice questions and comments. You can just use rather, pardon me, you can just use the raise hand icon, where you can, and if you see that, I'll promote you here. I have the HR function of promoting people today, right? I'll promote you here to become a panelist to be able to speak. I hope Mrs. Besiako will not find me for taking that responsibility. So if you raise your hand and we have a little bit of time, I'll promote you to become a speaker, if we have time to be able to take that. Ladies and gentlemen, without wasting much of the time, Professor Pat Utomi is online, and he will be speaking to us today about Wellvolution, health for the wealth of our nation. So I don't want to take away the shine from him because I'm not a professor yet. So, Prof, if you are there, you can turn on your camera. I will spotlight you right here.
My camera is on.
Fantastic, Prof. Thank you very much. How are you today, sir?
We're thankful.
Fantastic. Welcome on board. So on this note, I'm going to be handing over to Prof, who is going to be speaking to us on that note. And over the next few minutes, we'll hear Prof speak to us, after which we'll move to the panel. Thank you very much. And I'll see you after the keynote.
Okay, well, thank you very much. It's a pleasure to be able to join this very important conversation. One of the things that I have worried about the most in the last 40 years is, why do some countries thrive and others fall into poverty? If you look at the space, the human space in the last 100 years, take some comparisons. Argentina and the United States were almost exactly at the same level of development in 1929. If anything, there were things about the background of where Argentina was coming from that would seem to even give it advantage over the United States. But by the time we reached the 1980s, of course, the United States was by far the preeminent economy in the world, and Argentina had dropped to West Africa GDP levels. You look even further back in history at Spain compared with, quote unquote, smaller neighbors like Switzerland, Belgium, the Netherlands, and resources were moving from Latin America through the conquistadores back to Spain. A couple of generations later, these countries were much, much wealthier than
going to the CHF.
I think there's an interference.
Something very commendable. Yes.
Some muting
I was
is required.
shocked to see the videos, and I'm able to say, okay, this is why patients didn't get much.
Are we able to?
Yes, just give me a minute, Prof.
Okay. Out of pocket
I'm
to
on
get
that.
treatment. I also heard when they said 2017, that's when nothing was working. Yes, when I had my experience in 2018, and for radiotherapy, I was supposed to do in 3 weeks back to back.
Okay, so I began to try to figure out what it is that made some countries more successful than others. And in 2006, I actually wrote a book titled Why Nations Are Poor. It's interesting that 10 years, exactly 10 years later, in 2016, two Americans wrote a very similar book titled Why Nations Fail. Now, in the book, Why Nations Are Poor, which I wrote, I tried to offer a framework for understanding how countries make progress. And this framework is made up of 6 or so sets of interdependent variables. Amongst these interdependent variables is one on human capital, and human capital is about health and education. Why are these so important in setting nations apart from one another? I said in that book, for example, that assuming that we have made some appropriate efforts and things were going well, industrialization was picking up, and somehow we don't have good healthcare system, and all of our people are about to die from an epidemic. This was before and this pandemic. HIV/AIDS was what I used to. It would not matter what we had invested in everything else if the people were all dying, literally. But even much, much clearer, a Princeton economist called Angus Deaton engaged his subject years. Well, he'd been talking to it for some years, but he engaged it more squarely just about the time that I wrote Why Nations Are Poor. He actually published a few years afterwards a book titled The Great Escape: Health, Wealth, and the Origins of Inequality. Angus Deaton went on to win the 2015 Nobel Prize in Economics. And the basic thesis, really, in Deaton's work is to suggest that the inequality amongst nations is significantly affected by the quality of healthcare in those countries. I mean, going back to look at how the discovery of the penicillin and all of those made a difference to the capacity of man to create wealth. You come down to national health policies and see their impact on human productivity. I, in recent times, have been speaking quite a bit about issues around healthcare because I have had my own health challenges. And I note, for example, that there are certain healthcare systems where you are literally compelled to run certain checks at certain ages and so on and so forth. And this is for a variety of reasons. First of all, besides the cost to the national economy, if your productivity is much lower because of health interventions that could have taken place, a lot of Nigerian men, the statistic I hear, for example, in a place like Lagos, is that of Nigerian men over 60, 50% of them are likely to be challenged with prostate-related issues, prostate cancer. So besides the problem that this creates in slowing them down and preventing them from being productive players in the system, at a time when many of them will be actually at their high output capacity level, there is the burden on the general healthcare system of treating so many people who, had they run checks 15, 20 years earlier, would have found developments that could have been treated at an early stage, and the care burden for the entire economy would be lower. So health does matter a great deal. And to just put it in a simple context that we can deal with, is a story from a motto, a remark, which I use in my MBA classes to make a point many years ago. There is a secondary school in Owerri called Government Secondary School Owerri. They have a motto which, if my research proves me right, was probably adapted from something that I believe it was the great preacher, what's his name, that said something like that, and it was adapted. It became the motto of Government Secondary School Owerri. And that is, work hard, play hard. When wealth is lost, nothing is lost. When health is lost, something is lost. When character is lost, all is lost. And I had the good fortune back in those days to run into a video on the internet of an American billionaire who had gone bust. He was getting out of the subway in New York, and he saw a homeless man, begging. And he looked at the man and said, "Oh my goodness, this guy is worth much more than me." He said, "At the very least, he's worth zero, but but I am worth far less than zero. I am in so much debt." And that billionaire, with a few short years, restructure, pay off his debts, and become a billionaire again. In fact, he was to go broke again, I believe, and then return to being a billionaire. The big interesting story is that man would, years after my teaching of these classes, actually end up as president of the United States of America. That gentleman is Donald J. Trump. So this video from about 25 years ago of him going bust and coming out of the subway in New York was the video that I would play in class back then. Now, so when wealth is lost, nothing is lost, because you can always make money back, but when health is lost, something is lost. And my illustration was that of Steve Jobs. Steve Jobs changed our world. His technology made work easier and made him a fortune, became a very, very wealthy man. But not paying attention to a health issue developed to a point where, with all the money in the world, he couldn't pay somebody to die for him. And in the very prime of his productive life, we lost Steve Jobs. So when health is lost, something is lost. So this really compels any economy that wants to grow to ask the basic question: how can we ensure that we intervene in the most cost-effective way to ensure the wealth of the nation, which is the health of the nation? Amongst the countries considered one of the best places to live in the world is Canada. And one of the true, if you will, secrets of Canada's success is its healthcare system, preferred by most to that across the border in the United States of America. And so the question is, how can we deliver most cost-effective healthcare to our people? It seems to me that health insurance is a path that has worked in several countries. How we structure it in any country depends on the quality of the leadership and its commitment to its people and its understanding of what really makes for wealth creation. I think that we have had several experiments. I believe that there was an experiment by a Dutch group working through Hygeia in Kwara State or so, in communities. I have personally advocated different approaches to community health insurance, including, getting diaspora communities, to get together and say, look, structure something for your village and X, Y, Z. It will eventually cost you much, much less than, your old mother in the village getting sick and you're trying to bring them to America and all of that. A kind of community health care insurance system. But that's for you, the experts and the actuaries and the providers of healthcare to work out. The important thing, the fundamental thing, is that progress is denominated significantly on healthcare, and that the society that wants to become prosperous in a sustainable manner must engage very, very deeply the question of how it ensures the health of its people. Ours sadly is on a wrong trajectory where we are spending so much money training doctors for other societies. Some of the last statistics I saw suggest that more than 70% of the young men and women who are in medical school in Nigeria expect to leave as soon as they can get a chance to. Many years ago, when it was still something you could make a joke of, I used to tease my old schoolmates who were doctors in the United States that, that they were cheats and that they went to medical school free of charge, literally speaking, in Nigeria. And the American colleagues have borrowed hundreds of thousands of dollars, which they'll be paying back during the course of their career to go to medical school. And they just take that investment that Nigeria has made in them and they take off and they come to the United States and they begin to ask us, what are you people doing in Nigeria? And look at the country, the mess it is. I said, look, pay back some of what you've escaped with in giving back, and Nigeria may be better off for it. It will be a more fair deal. But that used to be a joke, but I can't joke about that anymore because the condition is so much worse. The latest statistics that I know of suggest that 70% of all the doctors of color, Black doctors in America, are Nigerian. Part of the, I don't know if you call it positives of it, is that Nigerians, as a nationality group, are now probably the single wealthiest nationality group in North America, in the United States and Canada. Because many of the Nigerians are professionals like doctors, nurses, earning very well. And so the big question is, how do we ensure that this has consequence and impact in Nigeria, first and foremost for our healthcare system? I can say that I see some of the flowbacks. The first completely cancer-focused medical service or hospital or whatever in the country that I know of, because I've used their services, is the Lakeshore Group and Lakeshore facilities in Victoria Island and in Ikeja. The managing director, I believe, is based in the United States. He lives in the US and has set up with colleagues these facilities in Lagos. So maybe that's part of the trend of the future. I know of a Nigerian doctor in the US who comes back, I think, every month for a couple of days to do surgeries and stuff like that. And I set up a facility in Lagos. I know of a couple from the UK, many of who went to medical school here in Nigeria, in Enugu campus of the University of Nigeria and the UI, who come almost every month from London to have surgeries in Lagos. So perhaps these are some of the benefits in retrospect from our investing early in medical education, even though conditions here made our young professionals leave. But we're now getting a feedback into the system. Perhaps we can create insurance schemes around what they do, and that will reduce the need for people to go out there for medical care. I can tell you, this is again one of the matters I laugh about. When I had a biopsy and got a positive on prostate cancer about a year ago, I began taking a treatment at the Lakeshore place. And when some of my friends heard it, they were like, "What is wrong with you? How can you be taking medical treatment in Nigeria? Don't you see what you're made to do? Why don't you?" In fact, my young nephews and cousins who I had helped send to medical school, who were in the US and the UK, started a war on who will take me out. So in the end, for my safety, I had to go off to the US to have them take care of my treatment. But really, a system can work that will enable quality healthcare be received in Nigeria, and an insurance process can be incorporated that will facilitate that happening. So let me, I think, pause my remarks here, and I'd be pleased to come back by way of response to questions that are raised. One of the things to recognize that health is not just wealth. Health is the cornerstone of the prosperity of a society, and that we need to put more into organizing healthcare and to assuring that there's access to it for all, because that's what sustains the human capital that makes for progress. I thank you for listening to me.
Thank you very, very much, Professor Pat Utomi. Amazing one. Thank you very much. Health is not just the wealth of the nation, but a cornerstone for the prosperity of our society. I think that's like a word of marble out there, because when we're setting this, health for the wealth of the nation, but this, professorially, if I can use that word, puts perspective right to it. And thank you very much for that. If you have questions for Prof, please use the Q&A spot right on the Q&A icon right under your screen. When the moderator comes up, she'll be able to take your questions. And like I said at the beginning of this, if we have some time, we will be able to take voiced questions. But just to save a little bit of more time, we will now move to the next part of the conference today, which is the panel discussion session of the conference. And like I said at the beginning of this panel, we'll be looking at Prof's keynote, from 4 critical perspectives, which is, from the employer and the private sector perspective. It will also be looking at it from the government perspective, where we have Dr. Yakubu Agada, who will be speaking, who is the general manager of NHIA. We also have on the call Mrs. Gloria Ibeziako, who is the associate director and head of people and performance management at KPMG. She will be looking at it from the HR and business perspective. We also have on the call Dr. Misbah Oleolo, who is the country manager and chief medical director for One Health, who will be looking at things from the provider perspective, from the healthcare provider perspective. And lastly, we have Aboyeji, who is a techpreneur and an investor. So we are going to be looking at these things from different dimensions, different directions about what the future of healthcare holds for the prosperity of the society, just as Professor Pat Utomi has said. Without taking the shine away from the moderator of today, ladies and gentlemen, let me introduce to you the moderator for today for this eminent panel, Jumoke Odnulami, who is the Chief Customer and Marketing Officer of AXA Mansard PLC. Jumoke, welcome to moderate this panel. I will look forward to a very insightful session with your panelists. Thank you very much.
Thank you very much, Sheson, for that. Can you hear me?
We can hear you very clearly, Jumoke.
Okay, thank you very much, Sheson. And a very big thank you to Professor Pat Utomi for the very insightful presentation on health for the wealth of our nation. I think Sheson summarized a bit, and I think all of us on this call are in agreement or in alignment when you say that if you lose your health, then you've lost something big and something very, very critical. I'm happy that Professor Pat is on the call. We don't have all the questions in the chat box yet, so we'll just go straight onto the panel discussions. And then we will also be calling on Professor Pat Utomi during the course of this discussion to shed more light or on his ideas or thoughts around the different aspects. So thank you very much, distinguished panelists. Like Sheson has said earlier on today, we have on the call Mr. Ini Aboyeji. Thank you so much for joining us today. I think we will just start the conversation with you. Are you on the call? Can you hear me loud and clear? I can't hear you. Hello?
I think he's trying to sort out his mic.
Hello,
Okay.
can you hear me? Can you hear me? I just tried to use headphones. Okay.
Yes, I can hear you now.
Yes.
So
okay.
Thank you very much for joining us on this
Thank
call. Sheson failed to read the profile. I don't know, Sheson, why didn't you read his profile? I think
I was
basically
just trying to save time.
to save time. When we were trying to summarize, we weren't quite sure which to go for, and hence the summary, investor and techpreneur. And so it's really, really, we're very delighted that you could join us on as a panelist today.
Thank you.
So we're talking about tech for health. If you're looking at tech for health, in that space, basically we have seen a bit of investment in tech for health lately, albeit not as sexy as or as fintech, or should I say not as large as what we are seeing in the fintech space. But my question to you, and I want you to elaborate to us, basically two in one. The first is that the investment that we are seeing in tech in the health space, basically in areas of telemedicine and other startups coming into it, what has been the impact? Are they increasing or reducing cost of healthcare? And what role do you think that tech can play or will play in the future in the healthcare space for Nigeria, both in terms of skill, in terms of care, and in terms of infrastructure.
Fantastic. Thank you very much for having me here. I think, with healthcare over the years, particularly with AXA Mansard, we've come through a very long evolution. And whenever I'm asked this question, I like to actually start from where we're coming from, because it's very easy for one to basically begin with the negativity of how the system is today. But the reality of the matter is that healthcare has actually improved in Nigeria over, if you take a long view, right? And simply, if you look at the numbers, right? More babies are being born and not dying before the age of 5. More people are living longer and not dying before the age of 40. Now, there's obviously a ton of challenges, but I think it's also helpful to consider how far we've come. And even on the policy front, health insurance is increasing in adoption. And most recently, we have the NHIS system and the state HIS systems also being slowly adopted. However, I think the challenge that we have is that we're trying to build a modern health system on an old, on what I call outdated infrastructure.
Right.
And back in the day, I think many of us would agree that, we needed a lot of things to make healthcare work. We needed the doctor, you needed the hospitals, you needed the, all these other things, a radiologist, all these different specialists basically that would have to come together to make a healthcare system work. The reality is that slowly but surely, increasing numbers of these people, thanks to new technology, new and nimbler technology and AI, are being replaced by machines. And so there's quite a number of things that you can actually do, especially when it comes to the diagnostics front, without necessarily being a professional, a health professional in the traditional sense, i.e. a doctor or a nurse. Simultaneously, the demand for health has also risen, right? People have gradually stopped going to to native doctors and are increasingly looking at modern health as a way to solve problems.
Right.
But that has also increased, because many of those parts of the country are not reached, that has increased the use of patent medicine sellers, right? Or chemists, as some people may call them. So I think and unfortunately, I think one of the big problems we have as a society is that we have a vision of healthcare that mirrors countries that are much richer and much more advanced from an economic perspective than we are. And then as a result, we ignore the practicalities of our reality, which as the vast majority of people cannot afford this extremely expensive healthcare system. And so what we've been doing when it comes to healthcare is really trying to figure out how can we do 3 things, right? The first thing is, how do we make diagnostics cheaper and more distributed, closer to the consumer? We've backed Medical Device as a Service, MDAS, which is growing as one of the largest diagnostics facility in the country, and basically enabling people to be able to diagnose, particularly in tier 2 or tier 3 towns, where there is not a lot of existing diagnostics capacity. The second thing that we're looking at is really, how do you enable remote consultation, right? Because that reduces the cost, right? So when you think about a typical consultation, diagnostics is actually happening somewhere different in most cases. And the average consultation is literally people paying a lot of money in transport to see a doctor for a conversation that, quite frankly, could either be had at the diagnostic center with the doctor examining the patient remotely using devices and data, and the doctor who's knowledgeable about things and can map different diagnoses to different treatments. and monitor them. And for me, I think that the more of consultation we can automate, the cheaper the cost of healthcare becomes, right? Where one doctor can actually handle far more patients and in a far shorter period of time. And then the third thing is fixing the funding ecosystem. Ironically, the money to treat poor, sick people comes from those who are healthy, but are still paying into a system. And that's the fundamental principle of healthcare. But unfortunately, I think because of a lack of accountability and also a lack of understanding, we're not really getting to the point where we're actually leveraging the monies of those who are healthy to lower the chances that they actually do become sick, right? By doing a lot of preventive care. And then second of all, cost effectively treat those who are sick, so we don't waste the resources of those who are healthy. And I think that there's an opportunity to do that with the state health insurance plans and what I call managed care points. So I think innovation across these three is really sort of our own focal point when it comes to healthcare. And I think at the end of the day, what everybody has to understand is healthcare is going to look very different in Nigeria than it does in the US, and thank God for that. and second of all, the reality is that the entire system's focus should be how do we get the best care for the lowest cost, right? So that we can reach more and more people. Thank you.
Thank you very, very much for the very insightful look into tech. It's actually very interesting. I think you talked about diagnostics being one of the core areas, or the core pillars that the tech can focus on. And I think basically that's, it's being done, but it needs to go on at a larger scale, will be the points that I will be taking from that. We have things like telemedicine that is up and running. A lot of providers have come into the market. AXA Mansard inclusive, we are able to provide telemedicine consultations. And I think that, continue to drive in that area will be very, very crucial to it. Incidentally, I'm not sure that the uptake is quite at the levels that we anticipate or we expect them to hit. However, I guess maybe that's not really for a tech conversation, but marketing and awareness of this needs to improve significantly. Thank you very much, Mr. Aboyeji, for it. I don't know if there's any other panelist that has a contribution around technology in the health space. Is Professor Pat still on the call?
Yes, I am.
Sir, do you have any comments?
On technology? Yeah, absolutely. Actually, plenty of comments on technology and healthcare. We can no doubt reduce costs dramatically through applying tech to healthcare, the healthcare space in many ways. Years ago, I began to advocate a very simple system that India used quite well for people in remote locations, where a simple kit allows somebody not trained as a nurse or physician to be able to take a blood sample from somebody in a very, very remote place, and it is transmitted, and of course the kit begins the processing of the blood sample or whatever, and a physician remote located maybe in a city far away can then prescribe medicine that can be administered right there. So we save the cost of the person getting on 2 or 3 Okadas before reaching the first bush truck that will then take, all the distance to get to some place for, and because many of these things are things that at the primary healthcare level can be managed. India did it quite successfully, I think, and there are ways that we can apply that. Getting even more sophisticated in the tech space, we now see the possibilities where the finest specialists in the world, located maybe in the Texas Medical Center, can guide surgery in Ekiti or wherever it is. So telemedicine is advancing, and we need to be able to take advantage of it. But what needs to shift is our mindset of how we bring solutions to health care problems to people. And I think that a good working insurance system can facilitate this. I mean, there's a tendency for professionals to get into excesses, which outsiders with capacity to think out of the box can bring solutions to. Again, whenever I think of insurance, one of my favorite examples of how insurance changed our world is, I mean, insurance was thought of as a problematic thing in the early days, 200 and something years ago, back in the US, because most of the factories, textile factories, just got on fire. It was so easy to have a textile factory fire.
Right.
And you had so many fires, and it was like, oh my goodness, this is not good business. It was insurance people who thought up of the water hydrant. And the hydrant dramatically reduced fire and made industry grow. So I think that this kind of relationship between experts and people coming from another perspective can help us grow. So I'm hoping that the insurance industry becoming more involved with
Innovation.
Innovation in healthcare can significantly reduce costs, increase access for many people. And with AI and all of that, the possibilities are infinite.
Thank you very much, Professor Pat. Thank you very much for that. We will still take some comments in the health, on tech for health at the end of the session. But let's quickly move to Dr. Oleolu. Dr. Misbah, are you on the call? Can you spotlight him, please, Sheson?
Hello,
Okay.
okay.
Dr. Misbah, okay, good.
Okay. Hi, Dr. Oleolu. I believe I pronounced it very well this time around. Congratulations once again on the opening or the launch of your state-of-the-art facility. That's a really exciting one. Congratulations on that. I think that my question to you, and I think Professor Pat also talked a bit about it earlier on, we have seen a lot of brain drain in the health sector, in the medical sector. It's interesting when he gives statistics like 70% of colored doctors in the US or North America are Nigerians. And I think that it is escalating in the last couple of years. It's escalating. We are thankful for people like you that are returning to the shores of Nigeria, moving in the inverse direction. But basically, what are your thoughts on, the role the private sector is playing and how, first and foremost, it can work to curb this brain drain and how, it can also drive the inclusion or total inclusion of basically the entire country in the healthcare sector.
Okay, thank you. Thank you for your question. So I'm going to say something really controversial here because I feel that one of the things that we must be able to do is to make places like this opportunities for robust debate, as well as a safe space for us to air all views that are reasonable, so that we can put everything that is useful to us as a nation in the mix. So it would be a bit hypocritical of me to criticize people who leave this country as young doctors for two reasons. The first reason is that the local training has almost completely collapsed at postgraduate level, whereby getting people into residency positions to train as specialists is either almost impossible, or when it does take place, they spend long periods out of training because of strikes. And if you consider that the training is often for a finite period, if the training period is, say, for example, give or take 5 to 7 years, then if you spend 3.5 of those on strike, that is 3.5 years of no credible training. And if we go by the dictum that says it takes 10,000 hours to master a skill, you just have to do the math to see how much less of a skill set those people will come out with. So unfortunately, I do not necessarily, and I know this is a very controversial view, I do not necessarily think brain drain is a bad thing for us as a nation. What I think is a bad thing is the lack of brain gain. So what we're essentially, if we look at this from a purely agricultural perspective, what we're letting go of are raw materials, they're unprocessed goods. And I don't mean to be rude, value add at undergraduate level is actually quite minimal. However, when you have a value-added good returning to the system, for example, the sort of specialists that Professor Itomi was describing, now these are people who the consultation of a specialist in Texas is probably the equivalent of 20 junior doctors. The decision he makes, 20 of them will bounce that idea around. So I think what we should be working on aggressively is brain gain. How do we bring our compatriots who are no longer on these shores back, whether digitally or physically? So when we talk in AXA as an entity of the phygital solution, the phygital solution we should be thinking about is not just the infrastructure, but also the human capital. So we now need to be thinking of how we can phygitalize human capital, i.e., bring back human capital both physically, but if we can't do it physically, then we need to think of a digitally enabling way of doing it. What can we do? So one of the things, and I, of course, One Health and AXA in particular, so here I'm talking about the bigger AXA group, is not your classical player in the sense that, of course, we're very, very advantaged. We're in a position of huge advantage. And one of the things that we have noticed since our medical center launched is that a lot of our compatriots in the diaspora haven't seen the launch material, have been suitably impressed to commit some time or commit some sessions to wanting to participate in what we do. And I think it is taking responsibility for creating a new ecosystem. And for me, that new ecosystem would involve, in the case of AXA, some significant investment above the average for this environment, some significant moral. So there is the financial investment, but there's also the moral investment or the corporate social responsibility side of it, where it is not necessarily just about the financial returns in the case of AXA. It's actually about making an impact in those areas of human endeavor or human activity that matter. And I think by bringing all these strands together, one, providing the financing that creates centers that people recognize as being of an international acceptable standard. And note, I have not said an international standard. I have said an internationally acceptable standard, because we have to understand that we cannot bring Harley Street back to Lagos, and we cannot bring Harvard back to Lagos, but we must have a standard that is acceptable. So, back to your question, I feel that in terms of what we can do from a brain drain perspective, I don't think you can stop these youngsters. The environment is very hostile to their professional development, never mind their personal aspirations. What I think we need to be working towards is that in 10 years, when on their hierarchy of need, they feel fulfilled and think, okay, what is going to be my legacy and what am I going to contribute to where I am from? We need to be prepared by having the centers that they recognize as places where they work. And it therefore means that our investment in financial terms and in terms of social responsibility must be on ground, must be ready, and must be open to all sorts of arrangements, whether they are in physical form or in a digital form. So I'm afraid I am for brain gain rather than fighting brain drain. And I know it's a very controversial view.
Okay. Thank you very much, Dr. Oleolu, for those for the very interesting comments. Focus should be on brain gain. Is basically the summary of your submissions to us. I wanted to give an opportunity to any one of the panelists to share their thoughts or remarks on Dr. Oleolu's position. If anyone is interested, very quickly, because we would need to move to the next panelist.
Can I make a quick comment? This is Patu Tomi.
Yes, sir. Please go ahead.
Yes, I don't think that there is much to quarrel with on the perspective he has taken. I think that, in fact, that is part of what I was speaking to in talking about these sets of doctors who set up facilities in Lagos, from New York and from the UK and all of that. I think we need to think more in terms of brain gain and what we can take. In fact, my view is that it is the brain gain factor that will eventually save Nigeria across the board. The quality of human capital that we have is now majorly outside of Nigeria. And they and their children will be the ones that will turn Nigeria around. If we just take the example of India, and what happened after India began to make more sensible policies following the Rao shift in 1991, when India was technically bankrupt, 3 weeks trading money in its reserves. And Manmohan Singh was appointed finance minister. A few policies began to be changed. And I used to say in classes at the Lagos Business School around 1994 that India's reserves were surging by about $1 billion a week, and that the major source was from a village in Nigeria, and they were wondering how. Major source is from Nri. I said, Nri, how can Nri give $1 billion? And then I would laugh and say non-resident Indians. And that's what NRI was, and it was a big source of the surge in India's, if you will, flow back. And so, yes, taking the perspective of brain gain is very, very important as we engage. Again, if we look at the major turnarounds of the 20th century, whether it's the post-Meiji Restoration Japan that profited from the Japanese diaspora, majorly in Germany. India's example that I've given, China's example, we can hope very much for a great benefit to come back to Nigeria from those in the diaspora, and that is the brain gain that we have. Thank you.
Thank you so much, Professor.
Okay, I'd just like to say something.
Okay. All right, very
just
quickly.
A few minutes, yes. I just want to add, and I like Dr. Oleolu, I thank you for your perspective. I think I'm talking from a human resources perspective. And so I like the fact that you're talking about the brain gain, because indeed we can't fight the battle of the brain drain. It is what it is across the economy. And I think that one area, I think that probably, I don't know if it's the medical association, because we have quite a number of professionals who are breaking frontiers abroad. And you did mention the fact that, there's no development, there's no training, they are not learning in terms of those who are still in the country. I think one area that we can help is to keep a track on these great doctors who are doing great things abroad, and try to find a way to bring them home to come and impact those who are back here in Nigeria. I think that most times, which is like the way we manage people leave and no one is keeping a track on what they are doing or what is happening to them. And then when you don't keep a track on them, or you don't keep the communication open, when you reach out to such people in another 10 years or 15 years, they're just going to look at you, who are you, where are you coming from? So I think collectively, we all have to come on board with this whole brain drain and bring the gains back. They may not want to come back because of the current reality, and you can't fight them, but we can help them to come home, to come and help to develop those who are still in the country. Because of course, Nigeria is still home. They need to have a place to come back to when they get to the point of retirement. Thank you.
Thank you very much. Thank you. I think we'll just quickly take Mr. Boyeji. His hand has been up. And then I will be coming back to you after his comments.
I really like what has been said about brain gain, but I also want us to consider the human resource opportunity that there is in healthcare. And I think that's something that is often missing in the conversation. The world is aging. More than in for example, over the next 20, 30 years, right? America, the median age of an American, meaning half of the country, will be 40, right? So that means half Americans will be under the age of 40 and half will be over the age of 40. And then if you go to other countries around the world, you will see the same pattern, where the world is generally aging except for Africa. And the reality of being a small country with 200 million plus people, this year, the continent will add another 25 million young people, right? So, and in Nigeria alone, we give birth to about 25,000 babies every day. So when we think about those realities and where those kids need to be useful, I feel the missed opportunity is really not even looking at brain drain in the traditional sense, but really thinking about it as an opportunity for us to build human capital that can come back. I like to say that if you calculate the incomes of all the doctors we have exported around the world, from LASU and from Lutz and from UI and all the Nigerian universities, you would easily hit about $1 trillion over the last 30 years, right? Just based on income. If you were even just keeping, 1% of that, that's $1 billion, right? And that can do wonders for the health system. So I think the industry needs to be far more strategic than it currently is being around even this brain drain argument. Somebody has to finance healthcare professionals, healthcare workers, and rather than us looking at it as something bad, we need to now start looking at it as a real opportunity for us to export our talent globally.
Thank you very much. Thank you to all our very distinguished panelists for all the submissions so far. I think, very interesting conversations, and we hope that we will be able to keep the conversation going through other forums. But for now, I want to quickly switch to the HR topic, healthcare. And this is Mbesiako. I'm coming back to you. And thank you. I think you started making a few comments in that direction, but we want you to elaborate more. We know that, we're in a, should I say, a time of economic hardship. And there is, in spite of all the investment in healthcare, there is rising cost in the healthcare sector. At least, and some employers, for us in AXA Mansard, a lot of our clientele base is still in the corporate sector. A lot of employers are struggling with balancing the health care cost with productivity. We just want you to enlighten us a bit, share your insights on how employers are doing that and on what they should be doing to ensure, or how they should basically be balancing their cost vis-a-vis productivity from their employees.
Okay, thank you very much, Jumoke, and good afternoon, everyone. I think for me, listening the well-evolution, right, the first thing that came to my mind was actually when Professor Patutomi was talking. The first thing he said, which I want everyone on the call as well as the panel, is that he said to us that when health is lost, all is lost. Absolutely. So in any organization, you cannot operate without a healthy workforce. That's my view. My view is if you cannot talk about productivity, you cannot talk about profitability without a healthy workforce. So the question is, when it's time for you to relook your remuneration, relook all that you need to do to retain your employees, to be more attractive outside, you can't take away the health aspect. Health is very important. So for us, for a lot of young talents, when you want to hire, they look at what is it that you have to offer them when it comes to health. Absolutely. And when you talk about health, they don't just want a little health cover that can just cover basics. You even have to, you have to make sure that the health cover you have is quite robust and that can take care of things in case of eventualities. And the reality on ground is there will always be eventualities because people's health at different degrees. So based on my experience and all that my organization have done is that every year we sit back and say, what are the health insurance offering us? If the health insurance we took this year, is it going to be robust to take care of the next year? Yes, we have the productivity. Yes, we have our profitability in terms of bottom line to look at. But guess what? If you come in every day and you see people who are going off on 2 weeks, 3 weeks, 1 month sick leave, that's a red flag. It means that it's either you're not getting something right. So in my view is that to deal with the rising cost, organizations have to say to themselves, out of their, assuming they have 50 billion as their bottom line, they have to intentionally say to themselves, out of that 50 billion, we're going to allocate a certain amount in terms of healthcare for employees. And another way we do it is that another way employers need to look at is that, the good thing about COVID is that COVID was a wake-up call for so many organizations that didn't care about having preventive care for their people are waking up to realize that you need to put a lot of those things in place, because when you educate your employees, you let them know there are certain things, there are certain habits you need to change. There's certain things you need to stop doing at a certain time. It's a way of educating the workforce. Also, when you look at the wellness program, it's time. A lot of organizations. So when you put a good wellness program in place and you have the preventive care, you mentioned, I think one of the speakers mentioned telemedicine. I mean, regarding it, it's a good initiative. So it's like employees feel this is an employer that cares about our well-being. So in terms of how that balance can happen is that the balance is not negotiable. The balance needs to be achieved. The fact is that inflation has gone up, so there's no way you will sit back and say, if you have a health cover of 200,000 last year, that same 200,000 is going to take care of your healthcare for this year. You need to sit back and pick up data and say to yourself, how can your employees who were on 200,000 insurance health cover, can that 200,000 still give them a proper health cover for the next 1 year? If it can't, then you need to relook and say to yourself that you need to, because sometimes when we do, as corporate organizations, even government, you find out that when we're relooking what we offer to talents, the first thing we think about is what they can hold in their hands, increase in cash. But guess what? If you increase the cash and you don't increase the health, then what happens? If the health situation happens, then the company has to bear it. Because of course, if you have an employee who comes into the office and is apparently suffering from one ailment, and probably you're not even aware. I recall, a couple of years ago, for my company, thanks to AXA, they were there for us. We had a serious issue. We had to bring in an air ambulance to take care of an employee. So if we didn't have a backup, if we didn't have that plan, to the fact that, you know what, those eventualities will always happen, whether it's a one-man company, whether it's a small company, a medium-sized or a large organization, you must make that provision. Otherwise, you will not see the best in your employees. You will see that there will be, as doctor said, it's not going to be a brain drain. It will be a company drain, because competitors are taking your talents, and talents whom you have trained, whom you have skilled. So my view is that, employers, in dealing with these rising costs, they need to first look at their data. What is the data? What is the inflation? What is the country talking about? The insurance that you have, thank God to the government, taking an insurance is a compulsory thing. So companies, whether small or big, you can't even dodge from it. Say to yourself that the cover you have, can it take care of emergencies when they have? And I believe if you have that and you do the wellness, you have the preventive healthcare, you have the educational platform where you can educate employees, have regular webinars, tell them about different aspects of healthcare. I think that you'll be able to get them to be more productive, and they'll be more available to achieve the bottom line of the company. Thank you.
Thank you very much, Ma, for those submissions. Thank you very much. It's very clear from your submissions that you have been able to directly connect the health provision for the welfare of the people to the welfare of the company as well, to the bottom line of the company. There's a connectivity. So the way from what you have said, I see it as a win-win for all, because ultimately, when your employees are well, they will be more productive. And when they are more productive, that's more profitability for the company. And that is really essential for companies and HRs to look at it and as healthcare costs, not just from an expense perspective, but more of an investment perspective. It is an investment that is ultimately going to generate returns for the company. So thank you very, very much for those submissions. I don't know if I have just a few minutes, if anyone else on the panel wants to comment on this. I see Mr. Boyeji's hand is still up. I don't know if it's from the last time.
It is from the last time. Sorry about that.
We haven't heard anything from Dr. Agada yet. Are you on the call, sir?
Yeah, so I'm on the call, and then we are multitasking, running up and down and all that. So I've listened to some of the talks, and especially to do with the telemedicine. I happen to have the opportunity of being on the board of one of the bodies working on telemedicine for some years. And I think one of the key things that we need to quickly do is to have a national policy for e-health and telemedicine. That's the way to roll it out universally in Nigeria. So the big obstacle to that becoming wide and catching fire in Nigeria will be that national policy. We worked on that for some time with the Federal Ministry of Health. Right now, I don't know how far we've been able to go with that. So driving that will work. I am also aware that a lot is being done in telepharmacy already. People are able to get their drugs and all that, which is good for us. Telemedicine and e-health is even more important in a country like Nigeria. We have a resource constraint, and then we also have constraints in terms of human resource for health. And so in an area like radiology, why shouldn't somebody in Louth be able to, read films and be able to make a recommendation for an X-ray that is taken in Ekiti State somewhere? That we should be able to do right now. But we need the appropriate policies. We need all these things in place so that we can move that aspect on. So that is key to what we'll be able to achieve in that area. Thank you.
Thank you so much, Dr. Agada. I was just going to come back to you next because we want to take the discussion to the regulatory end. We are aware that states and nations have signed the mandatory law for provision of healthcare. We want you to tell us a bit more about this and what strategies will draw the over 200 million Nigerians into this healthcare safety net.
So thank you very much. I'm not in the office, so I was wondering between putting on the video and not. And so I'm somewhere in a meeting, I had to step out. So very interesting question you have asked. And I think is the right forum to talk about that shortly. So we have an act that was signed into law by the former president, and we have worked assiduously to try to operationalize that act. And one of the first things you want to do is a secondary law, which is the operational guideline. That is ready. It has been approved by the Federal Ministry of Health. And on Tuesday next week, precisely, I think on the 10th of October, we'll be unveiling the minister, the coordinating minister for health and social welfare will be unveiling that document, and then it becomes operational in the 36 states plus FCT. So we're happy to have done that. We also have 2 committees in place. The other 2, the mandatory health insurance, will look at operationalizing the mandatory aspect of the law, which says that every Nigerian and every legal resident should have a health insurance, the primary health insurance, which will help to develop the health system. Like health insurance is the main financing mechanism for the health system. So we are also looking at the possibility of having something that a committee, which is already set up and has made far-reaching, recommendations in the area of innovative financing. So that will help us to identify those who cannot pay. And the good thing is that the National Health Insurance Authority Act of 2022 had already identify the vulnerable group fund as one of the mechanisms that can be used to fund that. So we're also looking at that. How do we quickly deploy that aspect of the law to be able to pay for those who cannot pay? So that's the vulnerable group fund. Hello, can you still hear me? Hello?
Hello?
Yes, we
Yes, we
can
can
hear
hear
you.
you now. Your video is off.
Okay, so yeah, I put it off because this place is not, like I said, I'm not in the office environment, and
No
I'm
problem,
moving
sir.
from, I'm having something that looks like a dynamic office around here, if there's any word like that. So we have the vulnerable group fund, which is supposed to finance all the people in Nigeria. You know what all the different statistics we have about the vulnerables in Nigeria. So we need to also provide for them. So that will be more like tax-based financing that will happen around there. So we're working on that. The innovative financing is supposed to find sources of financing for this group of people. And so we are leveraging on that particular aspect of the law to be able to, raise funds from government, from the private sector, and from development partners to be able to fund that 83 million Nigerians, according to the estimate by the Lancet, the Nigerian Lancet Group. And we have different statistics from the MBS and all that. So those are the three main committees that are looking at implementing that act. The Operational Guideline Committee, the Committee on Innovative Financing, and also the Committee on Mandatory Health Insurance. The one on mandatory health insurance is supposed to make it mandatory both at the level of the state and the federal for people who can pay pay premiums for themselves to be mandatorily pay premium. So those are the main main programs that we have put in place to actualize that act.
Okay.
Thank you.
Thank you so much, Dr. Agada. Thank you very much. In spite of being in another meeting, you were still able to join us. I want to quickly take questions from the panelists for Dr. Agada or comments before we take, we have quite a number of questions for all our panelists on the chat. Does any of the panelists want to? Yes, please go ahead. Hello? Can you hear me, please?
Yes, we can hear you.
Okay,
We can
please
hear
go
you.
ahead.
Yes. I mean, for me, I think in closing remarks, I really agree with what a lot of the panelists have said, but I really want to throw a challenge to AXA, especially as a leader in the health space,
Right.
to really push the envelope when it comes to some of these opportunities in the health space, particularly when it comes to lowering costs, which benefits you, and being able to mobilize capital for healthcare, both in terms of making the costs cheaper by deploying the use of technology and distributed systems, and also with respect to with respect to lowering supporting the development of health industry professionals by supporting those who are exporting some of them. I think that would be very important.
Sorry, I missed the last point. She said on supporting, there was a bit of
supporting the development of more health industry professionals, right, on account of the opportunity for exports. I think really investing in those areas will help the industry and also lower your costs over the long term.
Okay. Thank you. The points are well noted. If we have a bit of time at the end, I will allow the CEO of AXA Mansard, Toko Adeni, who is also on the call, to respond to that. we want to quickly take some questions for the panelists on the chat board. Sheson, do you want to read out this question, please, very quickly?
Oh, my apologies. I was muted. All right. So the first question is from Joyce on Nostella. Pardon me. I think that's how much I can pronounce your name. And that question goes to E. Can
Where
you
are the
please throw
people
more
then?
light
We don't even know
on
what
how?
is water.
Can you hear me?
Milk.
Dr.
Okay,
Agada,
coffee.
can you please mute your mic? Thank you very much, Dr. Agada. All right, thank you very much once again. So the first question is from Joyce, and Joyce is asking Ian to please throw more, Mr. Ian to please throw more light on how analytics can affect the major areas of healthcare business and how it can help create new insights for the healthcare space development, or the development of the healthcare space.
I think he answered that.
Okay, I think data is extremely important because it helps us to understand where to focus. I think that all of us, we like to pretend in the healthcare space that all diseases are created equal or impact the country, the populace equally. I'm really excited by what companies like Wella Health do, where they are able to create insurance packages for particular illnesses. And I think those are one of the things that can bring down. But a lot of those packages are influenced by data. So it's really important that we use data.
Thank you very much, Mr. Ian, for that. The next question goes to Professor Pat Utomi. Prof, are you there, sir? And the question is, what are your views about concessionary lending conditions to hospital? Apart from poorly organized health insurance scheme in the country, accessibility to bank loan is another limiting factor to the development of our health institutions. Did you get that, Prof, or you want me to take it again?
Yes, I did get it. It's a subject that needs to be given some deep thinking in many sectors that we need to, do some very important things. Same question is being raised. And as I responded just yesterday to a question, not in the medicine area, part of the problem is that at the time in the evolution of our financial system, there were sectoral allocations given to banks. Oh, you must lend so much to agriculture, so much in rural. And we had all kinds of sharp practices. People would find some way of taking something that belongs in another sector to a so-called priority sector to use to get funding to it. And those sectors just didn't get that funding because banks have an attitude to risk that, just made them scared of investing in those sectors they were supposed to, or lending to those sectors they were supposed to lend certain quotas to. And so we need something more creative where, the risk is managed in some way. And here's where an insurance industry can actually play an important role. But the kind of hedging that may be required for certain sectors, creative work may need to be brought in to de-risk them to a certain extent for the convenience of some of the kinds of commercial banks that we do have. But just decreeing that hospitals should get concessionary terms will not make it happen. So we've got to work at it to ensure really that this very critical sector gets the appropriate capital that is required. Look, when the conditions are set right, these become truly profitable sectors. I mean, talking about Nigerians who are in the brain gain situation. I had the privilege of visiting a Nigerian born and trained doctor, went to University of Nigeria, Nsukka Medical School and University of Ibadan, UCH. He became a little well-known when he donated $1 million to UCH when I think one of his classmates was a dean or something, and they were trying to raise some funds. I visited his office in the Bronx in New York. I visited him at work late last year. And still a fairly young Nigerian, actually. And if you saw the way that he was treated by his, let's call them colleagues, subordinates, you knew he was somebody who had accomplished significantly. But more importantly, you knew that the healthcare group he was CEO of was not a poor group. They were definitely very, very wealthy group, which is why he, as an individual, could afford to give $1 million to his alma mater. Medicine can be an extremely profitable business without oppressing those who get the care, but it has to be organized as a business, such that when you then have concessionary loan to that sector, you don't necessarily jeopardize the interest of the bank that is offering the facility. So that's my take on this. How do we organize medicine as business to make it profitable enough to attract that financing?
Thank you very much, Prof. This question, I think I'll just assign it to Mrs. Ubiziako. You've spoken to it a little, but I think this person needs a little bit of clarity. I think that has been the theme of your conversation. Considering the harsh economy in Nigeria and the negative effects on organizations' turnover, how can organizations beef up their health budget on an annual basis?
Okay, I think I responded to that, but I think how can organizations beef up their health cover, right? The person is asking how can organizations beef up their health cover, and I recall that when I was discussing it, I did mention that organizations need to be intentional in terms of the reality is that you have inflation, the prices of things have gone up. And whether we like it or not, just as I said, if your employees are not having access to good healthcare, you can't talk about productivity. So it's not about whether it's convenient or it's not convenient. It's something that it's a must do if you want to continue to be successful and getting the right client base. So I think that organizations need to say to themselves that work with the insurance companies. I believe there are good packages with every insurance company. And so organizations need to say to themselves that, okay, what are the likely coverage benefits that you can offer to me to the various level of staff I have? And then you can then take a judgment call. But in terms of the profitability, in terms of adding more cost to it, it's not a discussion that you can push aside and say it's not important. It is the number one thing that you need to be able to achieve. So you need to sit back and say, look at reprioritize, look at your cost. What are those costs that you incur in the company? Because sometimes you must agree with me that sometimes in organizations, there's certain things we spend money on. Can you imagine an organization having a year-end party? Meanwhile, the employees don't even have a good health care. So what's the essence of the year-end party when the employees don't have a good health care? So our employers need to sit back and say to themselves, what is really important? Is it better for us, the money, the millions that we're going to spend in having different parties, can we invest it into the employees and say, you know what, we're making your healthcare cover more robust?
Fantastic. Some quite unpopular opinion out there this afternoon. So, Mrs. Meziako just spoke about end of the year party and, committing a very good resource to the health of, employees. Interesting. So the next question is actually in between Mr. Aboyeji and Dr. Lolo, but I think I'll take Dr. Lolo first because he's the one who spoke about brain gain rather than brain drain. So, Dr. Lolo, are you there?
Yeah, I'm here. I'm here.
Okay, fantastic. So this question says, can telemedicine, artificial intelligence, and emerging technology help play a significant role in ensuring we tap from specialists in diaspora to consult with patients at affordable rates, so that not only elites will access specialist qualitative service, healthcare services?
Okay, I think that is a wonderful question. So one of my, I know there are bright people in the room, so I'm sure some bright person will take this idea away before I put it to use for One Health. But the joke aside, one of my great dreams is what I call telemedicine 774. And 774 is the number of local government areas in this country. And as you well appreciate, not all local government areas necessarily have health coverage. And I believe that it's well within the capability of organizations like ours at Mansard, or in fact, even state governments, to put tablets, smartphones in each local government area, each local government primary care center, such that aside from the primary care value proposition they get, they can actually communicate with a specialist who is either in a city nearby or at a remote location. So back to the question, I see a lot of opportunity to be completely disruptive in a manner that would be beneficial to our people. And I think the combination of artificial intelligence for purposes of triage and decision making, artificial intelligence to distill information for people who may not necessarily be specialists, for example, youth core doctors. We may be able to use things like artificial intelligence to create special clinical decision tools for them that allow them to make bedside decisions early before they either refer patients on or involve specialists. So in response, therefore, my feeling is that this is it's a great opportunity for us as healthcare providers, whether as private healthcare providers or even in the public space. And I think it's only a question of time before it takes off. And I'm even going to go one step further and say that the guy who comes to the market with the best and simplest and most customer-centric value proposition is probably going to clean out.
Thank you very much, Dr. Lolo. Because of time, I would hand over the mic back to Jumoke now, who is a moderator. There are still a few questions in the box. I would implore the panelists to speak, just skim through. There are others that you can, respond to. It will be very helpful. The questions are coming in torrent. I'm looking at 27 of them right here as I speak. So without much ado, let me hand over the mic to the moderator, Jumoke Odunlami, to continue the session. Thank you very much, Jumoke.
Thank you very much, Sheson. I think basically we are almost out of time. We have just 10 minutes to the close of this wonderful webinar. I just want to use the opportunity to say thank you to the moderators, to the panelists, and to Prof. Pat Utomi for joining us for this very amazing session. We look forward to more insightful sessions like this. And just to say that some of the charge, particularly the charge from Mr. Nyaboyeji to us, has been duly noted, and we will be working on, collating the thoughts and the ideas from this session towards, implementation. So without further ado, I will want to call on the Chief Executive Officer of AXA Mansard Health, Mr. Tokwe Adeni, to give us his closing remarks. Thank you very much, everyone. Tokwe, are you on the call, please?
Yes, I am. Thanks. Thank you very much, Jumoke. Let me appreciate the panelists, led by Professor Patutomi with the keynote address. Excellent speech. Health is not just for the wealth of the nation, it's actually the survivor pillar. So thank you very much. It's very important for us to pay attention to our healthcare, not only at individual level, corporate level, family level, and of course at the government level. He posed a challenge to AXA that must begin to invest into things that are going to be developmental. I'd like to also share with the populace that AXA continually innovates and partner to ensure that we push healthcare development to the new frontiers level. We partner currently with teaching hospitals to influence the medical curriculum development and to be able to ensure that we have much more enriched modern content into training our doctors to improve overall outcome. Also, AXA Research Fund is being used to lead on researches into disease-specific areas to solve tropical problems. For example, there's an ongoing AXA Research Fund deployed in Lagos University Teaching Hospital and University of Abuja on pediatrics. Continuously, AXA continues to invest. We partner with health technology companies, both in telemedicine as well as in SureTech, to ensure we continue to find a way for innovative access for every Nigerian. That's why you can see us in partnership with telecommunication companies so that millions of Nigerians can have access to affordable and equitable, high-quality healthcare. Once again, AXA will never rest. It's always eager and hungry to ensure that health is not only for the rich, but it's for the entire nation. And we are very, very instrumental in pushing the agenda of NHIA, of universal healthcare, which is something very primary for us. So at all levels, at AXA Mansard, we will continue to do that and lead innovation in the healthcare space. Once again, as we mark our 10th anniversary, we want to thank all the audience who have come to join us in this session. All the questions not answered now, kindly, we are happy to send you all the answers. Join us on social media and join us on our website to see current information. Use all of the available channels to be able to what is going on from 10th year of this baby that is helping the nation to develop in healthcare. Once again, thank you very much, Jumake, and all the moderators. Excellent. Thank you so much.
Thank you. Thank you, everyone. Thank you, Tokwe. Thank you, and Sheson, bye-bye.
All right, thank you very much, everyone, for staying tuned. Over 300 people still online. Thank you very much for the insightful session, Mr. Nyaboyeji, Dr. Misbah Lelo, Mrs. Gloria Beziako, Dr. Yakubu Agaga, Professor Patutomi. Thank you very much for spending time with us this afternoon and sharing your knowledge, your experience, and your expertise. I believe is that this will definitely inspire and stimulate the progress of the health sector in Nigeria to build prosperity for our society. So on that note, I want to say thank you and God bless. Bye-bye for now. Bye.